The doctor is here just in the nick of time, folks, because before kissing your sweetie this Valentine's Day, keep your lips in mind because they can reveal a lot about your health. So here to explain is Dr. Gregory Delost from Optima Dermatology. Great to see you.
Thanks for having us back on.
All about the big kiss today,
What a
right?
better day to
What a
discuss
better
lips,
day.
yeah.
Hey, so you say you can tell a lot about a person's health by the condition of their lips.
Absolutely, and it's a place that we often neglect with sunscreen through the years, and a very common place where we can see skin cancer. So that's a big place to look for.
Yeah, you talk about
skin
neglect. I
cancers,
mean, we got some pictures here. What's this a picture of?
So we have some skin cancer here, some basal cell and squamous cell cancer. Again, it's one of the places we often neglect, and could get very painful skin cancers there, and something that could be aggressive if not caught early.
And when you catch it early, it's not a problem, but if you wait and wonder and hope it goes away.
Yeah, could be bigger, more deforming, and more issues.
You know, a lot of times you come on and talk about things, and I can't pronounce them. Is this one of those?
Yeah. So this is called actinic cheilitis. So if we break it down, I always say that we use fancy words to make ourselves sound smart, but actinic just means sun. Cheilitis just means inflammation of the lips. So this is like a precancer condition where you get multiple precancers on the lips, and if they're not treated, they could turn into skin cancer. So this is something that we want to aggressively treat to avoid surgeries.
And to someone, here's another. This looks perfectly normal.
So if you look at the angles, so again, fancy word, angular cheilitis, so it's an inflammation of the angles of the lips there.
Oh.
And sometimes we could get saliva trapped in that angle there, and it could lead to secondary...
Oh, that's like the corner of the mouth?
Corners of the mouth. So you could get secondary yeast infections, bacterial infections there. Pretty easy to treat, though.
Is it, so what causes that? Is it like you don't do something enough, or it just happens because of the way your mouth is formed?
It's just like a natural crease where you could get a little saliva there and a little bacteria, a little bit of yeast in that area.
Probably not good if you're a drooler, huh?
No, not at all.
Not good for a drooler.
Yeah, not good for drooling.
Okay, what's the next picture here? We got another picture. Here we go.
So contact dermatitis, there's two versions of contact dermatitis. You could have what we call irritant contact dermatitis. The most common thing is lip licking, actually. So we think about saliva. Saliva is really important to digest our foods. Well, you get too much saliva on your lips and you chronically lick your lips, you could break down the tissue around the mouth there and cause a irritant contact dermatitis.
So people have like acid problems in their stomach, could they be more prone to having something like this?
It could be possible, like with reflux and things like that. And then the other version of contact dermatitis is allergic contact dermatitis. So some sort of outside product, whether it be like a propolis that's like in a beeswax that you could use for chapstick, or even like fragrances or things that you could see in lipstick too can cause this.
What's the next one here? There we go.
Perioral dermatitis. So perioral dermatitis was...
No wonder you had to go to school for 8 years.
Exactly. Yeah,
all these names.
All these words. So perioral just means around the mouth, so dermatitis around the mouth. And sometimes we call it periorificial dermatitis because you could get it around the nose and also around the eyes. And this was kind of like all the rave during COVID, actually. This is what we were calling masne. Now, perioral dermatitis is kind of like a rosacea variant, and different things could trigger it. So during COVID, wearing the mask, like the heat was a big trigger there. Sometimes I could see fluoride toothpaste that could cause this.
Whoa!
Yeah, cinnamon as well too is another random thing that could trigger this. And then if you use too many topical steroids on your face, could cause this.
You brought up something really interesting. When everyone was wearing a mask, it's like wearing a greenhouse on your face, right?
Exactly. Yeah.
Get all that humidity building up in there?
And they were always calling it acne or masne, but it was really just perioral dermatitis.
Ask the doctor if you want to know what it is. Another picture?
Venus Lake, and you were pointing that out to me.
I got a tiny one I've had for years.
Now, Venus Lakes could look scary because they could look darker, they could look black. Sometimes they could almost look like a melanoma.
If it's in a place like that, you probably don't want to keep it.
Yeah, you may not want to keep it. But the good thing about it, though, is it's a benign spot. It's just a blood vessel growth. But in order to get rid of it, there's a laser that we use called the V-beam where we could deliver energy to that blood vessel and make it go away.
So how does that work? So you go in, and how's the treatment? Is it painful? Is it messy? Or? Not
messy at all. It feels like a rubber band snap, and usually within a couple seconds you can make it go away.
That's amazing.
Yeah. You have to come see me and we'll take care of it.
That's great. That's a great idea. Hey, so we got all these how about, is there contagious things back and forth with lips? We're talking about people kissing?
Yeah. Impetigo is a big thing, where you get like more like honey-colored crust around the mouth. That's a very common place to get it. And then also like cold sores is another thing to look for too, like herpes virus, very common on the lip.
Okay, so if you have any questions, call Dr. Delost, check him out. Optima Skincare, and fix you up. Happy Valentine's Day.
Happy Valentine's Day.
There you go.